Welcome to What's Going On, the Martha Love Show. I am your guest host today, Latoya Sykes, and I'm pleased to welcome to the studio members of the Children's Community Health Plan Organization. We are so thrilled to talk to you today. Nasima Zakour, who is an HMO member advocate for Dental, Danielle Cotterall, who is project manager, marketplace development, and Tanisha Collins-Johnson, who is our HMO member advocate. So Nasima, welcome.
Thank you.
We'll start with you. I'll ask you a couple questions. Can you tell me, what is your role as a dental advocate?
My role is basically with, thank you first for having us here. And my role as dental advocate is basically to work closely with members and dental providers, trying to find them dental homes. What we call dental home is basically if a member does not have a dentist prior to calling us or actually contacting us, we're going to try to find them somewhere a dental home to go to.
Okay.
Also is to provide them with the resources and let them know that we have providers in our network that will be helping them out. And if they cannot schedule on their own, then definitely I'll be the one scheduling their appointments with those dentists.
Okay, so what is your background?
I am a dentist who basically trained and graduated from Algeria. And after immigrating to the United States, I worked in the dental field for all those 14 years. And I worked as an instructor for the dental assistant program and the medical assistant program at Kaplan College. Along with, after that, I had actually ran a school, private dental assistant school in Oconomowoc, and then I joined Children's Community Health Plan about 3 months and a half ago, December 14th.
Wow, some great experience there.
Thank
So
you.
much so, I just had to wonder if maybe I can grab you afterwards and you can look at my teeth. All right, so back to my other question.
Sure.
How do you connect with your members?
So what the members do is either they call the advocate hotline, and so they will get transferred to me, and then we talk to them. Otherwise, we can reach out to those members, trying to find them homes, as I said, dental homes. Otherwise, they are referred to us from maybe their medical or their primary care doctors, nurses, that they find out that, or other departments, that these people or these members need dental care.
Right, and what are your hours?
My hours are usually typical 8 to 5, Monday through Friday.
Okay, and so what are some of the job tasks that the advocates have?
Again, we go back to connecting with our members or reaching out to our members, finding them dental homes. I guess I keep repeating this over and over, but also is to try to expand to educating those members on the importance of oral health, which is at this point we find it as being a big deal, and actually this is one of the barriers maybe the members are having, and also to raise awareness about the dental care among our population.
I definitely have to agree with that. One of the things that I see most in the communities I serve is the need for a better understanding of oral health and how it plays a major role in your overall health and well-being. So
That's correct.
I definitely appreciate having you available.
Thank you.
And Ms. Danielle.
Hi.
So my project manager for
Yes.
marketplace development.
That's
There's
me.
been some buzz in the community about Children's Community Health Plan and how it may be entering the marketplace in 2017. So, I'm on a cutting edge, so I want to know, is this true?
It is true.
Nice,
Yes.
nice.
Yes, we're really excited. Children's Community Health Plan will be entering the marketplace as Together with Children's Community Health Plan.
Wow.
So basically that means that we're going to continue to offer the Medicaid program through Badger Care, but then we're also going to have another option through the marketplace. So when open enrollment rolls around, I think it's November 1st this year, when people go to enroll or renew their coverage, they're going to see Together with Children's Community Health Plan as an option as well.
Awesome. So tell me why you want to enter the marketplace.
I think for a lot of reasons. I think primarily it's just so we can reach more people. I think as a Medicaid HMO, we know that people aren't always eligible for Badger Care Plus. We call it the churn. So they go on and off based on their income. And when their income increases and they go off Badger Care, likely they're going to be going to the marketplace for coverage.
Okay.
So we want to be an option for them when they do. We think it's really important that for parents whose kids may remain on Badger Care or Medicaid, for them to get the same, not the same, but for them to get health insurance through the same company as their children. So if we're going to cover the kids through Medicaid, we want to cover those parents through the marketplace as well.
Nice.
And then I think the other piece of that, in addition to covering those people that may go off Badger Care, is really just to expand our scope. I mean, we've been doing Badger Care Plus for 10 years now. We know what we're doing. We have good experience reducing health disparities and improving health outcomes. And so we want to take that to the rest of the community.
Great. So what
Yeah.
would the process look like?
So the process for entering the marketplace, all insurance plans have to become qualified. So basically they have to go through a number of different regulatory things in order to be certified by both the state and the federal government. So the Affordable Care Act sets forth a number of different provisions that all insurance companies have to follow. We have to make sure that we're covering a set of essential health benefits. We have to make sure that we're allowing everybody to enroll based on their health history. So we're all going to be doing that just like the other insurance companies. Once the state and the federal government approve that we're doing everything we need to do and that we're in compliance, we'll get our certificate. And then, like I said, you'll see us on the marketplace in 2017.
Nice.
Yeah.
So who is eligible for coverage in the marketplace?
So to be eligible for coverage in the marketplace, you have to meet a few guidelines. You have to live in the United States, you have to be a resident of the United States, and you can't be incarcerated. In order to be eligible for that lower cost insurance, so there's tax credits and subsidies available to individuals. In order to be eligible for those, you have to not have health insurance coverage already and then be within certain income guidelines.
Okay. And then is the plans available for both adults and children?
Yes, absolutely. And we're trying to really make that point be known. So I'm glad you asked that. I think last year there was about 240,000 people that enrolled in marketplace coverage and in Wisconsin, and I think 223,000 were adults. So we expect our population to be primarily adults as well. You know, whether that's the young adult that just recently got off their parents' coverage, or if it's a person that maybe just doesn't have coverage through their job, like if they work in the service industry, or a family of four. Anybody, we want to cover anybody who's eligible, but we expect the majority of them to be adults.
Okay.
Yeah.
Now, when I look at the marketplace, there's just so many entities listed. How does Children's Community Health plan to stand out in
Yeah.
the marketplace?
Yeah, you're right. There are a number of insurance companies out there already. I think a few different things. I think first of all, Children's Community Health Plan is a nonprofit. We're affiliated with Children's, which I think brings a really good reputation. I think that we have a strong culture of collaboration and innovation and improving health outcomes. So I think those two things really make us stand apart. I also think that we strive and we want to be a high-touch health plan. So the programming that we're offering that you've heard about all day, the advocates for dental and for just our members, the prenatal care coordination, the disease management, all of those programs are really available so we can work with our members together to improve their health.
Okay, great. So tell me about what types of plans will be offered.
So when we're looking at the plans, we can't really release any details right away.
Oh, so I'm on cutting edge and that I can let everybody know that it's coming. So that means you're going to come back and let me know before everybody knows about the plans.
That's right. So
Okay.
after we get our certification, probably later on in the fall, right before the open enrollment period, we'll be able to share details about our network and our rates and benefits and everything. But the information about our organization is out there on our website, so that's always a good place to go to.
So if I want to start looking up now to figure out where I can go to learn more, I can go to the Children's Community Health Plan.org
That's right.
website. And remember, that's children's with an S. So it's Children's Community Health Plan.org website. And not only find out about all the great information we've talked about today, but also find out more groundbreaking news as it happens for the marketplace, right?
That's right.
Okay, great. Thank you so much,
You're
Danielle. And my advocate, Tanisha.
Hi.
I have some questions for you. Okay. Tell me, what function does Children's Community Health Plan play in providing needed resources to the community as well as the target member population?
Well, Children's Community Health Plan, we have 3 advocates, and we deal with medical issues in regards to people that has needing finding providers, finding dental, finding healthcare providers, like if they need to get a healthcare provider for pediatric, and then if their parents need the healthcare providers, we find them too. Okay. So we play a lot of different roles. Children's Community play a part in with the members that we serve. It's not only finding healthcare providers. If they have issues, they have grievances, if they have complaints, they can call us. They can call the advocate hotline, talk to any one of us. They can give us their concerns and issues, and we'll try to address those as they come.
Okay. So what services do the advocates offer the members?
We offer them customer service, first of all, by talking to them. We also offer them by giving them needed information, by providing them with directories and providing them with our counties that we serve, providing them with important phone numbers for Badger Care, how to reach the advocates. If they were in need of dental, we will provide them with that dental information. We will also refer them to NYSEMA, who's our dental advocate. We will refer them to our vision, which is HRSLOB. So we provide them with the necessary needed information that they need. If they needed to just have someone to talk to, and maybe they don't know the other entities like MTM, which is our medical transportation company that deals with our transportation ride, we give them that information as well. Okay. So it's a whole wide variety of different information that we provide to our members.
That is a lot of information. So where do I go? Who do I call? What number do I call?
The advocate number is 1-877-900-2247.
And so what outreach does an advocate do?
Well, the outreach that we do outreach for immunization calls. Okay. We do outreach to members for just finding providers if they need a provider and they call us and they leave a voicemail saying, I need to help, I need a primary care physician for myself, I need a pediatric provider for my child. We then will go to the steps of looking at the counties where they reside in, the zip code, see which providers that's open and that they have openings. We even go to the point of calling the providers, conferencing in with the members to try to get them the help that they need. We also do, I stated, immunizations. We do outreach for lead. We do outreach, just welcome calls. We do outreach for everything.
So I want to work back for a second to Danielle and to you both to answer this question perhaps. So one of the benefits I can see of you being in the marketplace and also serving not only children but adults is that when we call, so if I call for myself and a child, and tell you that I'm a member for both of us, then you can help me identify doctor's offices that we both could go to or that will be in close proximity. Is that correct?
That's correct.
Absolutely.
Absolutely.
Okay. And what are your business hours?
Our business hours are Monday through Friday, and we start from 8 a.m. to 5 p.m.
So the number you gave earlier, is that a number where someone could speak directly to a person?
Yes, that's our advocate hotline.
Okay.
That's our direct advocate number.
Awesome. So what services does Children's Community offer in the community?
We give out information, just educating members, and if they're not our members, we just educate people in regards to Children's Community and the different things that we offer.
Okay.
So the different entities, the PNCC program that we offer, our utilization case management that we have, and our advocacy team that we have, the dental and advocates that can help them find providers, help them find dentists, help them find our vision plan. Maybe they don't know who they can call to help them. So we give them a wide variety of numbers to say, hey, you can call this number and you can get me directly and I can help assist you with your needs.
Now, help me if you give me a number and I'm struggling. So perhaps I called and I got 2 or 3 numbers. And I'm struggling. And so I call you back and I said, I'm just having a hard time. What will you do in that situation?
If I get a call and a member calls me and they call 2 or 3 different people and they got the runaround, I'm directly going to help them right then and there. I'm not going to transfer them over to someone. I'm going to assist them with the needs that they might need right there. I'm not going to transfer them anything. I'm going to make sure that the call is completed so that they have whatever they need on that call.
So having heard that, I want to know, how can I meet my advocate?
Well, you can meet me. You can actually call me directly. I do have my direct number. I am out on resource health fairs. I do health fairs. I'm a part of a lot of community events that goes on in the city of Milwaukee, not only Milwaukee, West Dallas, and the counties that we serve. So we're always available. We have resource tables that have children's community information on there, and we're always staffing those tables.
Okay, awesome. So we've talked about a lot of things that advocates do. So is there anything else you want to add about what an advocate's job entails?
Most important things for members to understand that they do have an advocate that can advocate for them, and maybe they don't know it, but they do at Children's Community have members that advocates that are compassionate, and we love to help our members. And so at any cost, they can call us. We're not going to put them to the back burner. We're going to take care of the issues, and we're going to take care of them as they come.
Awesome. Well, thank you all for being here, and thank you for coming to answer questions. The Children's Community Health Plan, please go to the website at childrenscommunityhealthplan.org. That's children with an S. So childrenscommunityhealthplan.org, and look for more information. You have been tuning in to What's Going On, the Martha Love Show, and I am Latoya Sykes, your guest host for today. Thank you, and enjoy the rest of your day.
An MCM production.